I've got arthritis, so I've just got to put up with it. So is this true? This is something I hear people all the time say. They come in and say, I went to see the doctor and they said, I've got arthritis, so that's the end of that. Basically, you've just got to bear with it until you're ready for a joint replacement. Well, this isn't true. We already know this as physios, that basically exercise can improve load tolerance of a joint. It can improve the strength around a joint. There are so many reasons why exercise is very beneficial for chronic pain and arthritic pain particularly. And that means that this is way off base, and the perception of there's nothing you can do is incorrect. Now, we do know, like as I mentioned there, that exercise therapy advice is the cornerstone to managing the symptoms of and improving the function of arthritis. But what about something like massage? Sports massage, any type of massage really, does that actually have some benefit towards pain and function with arthritis? And there was an actual systematic review that they did here, which we're going to delve into, which highlights basically that there may well be some benefits here to using massage therapy in both rheumatoid arthritis and in osteoarthritis. So in this systematic review, they pooled from 7 randomized control trials, and they found that overall it was low to moderate evidence, which just means the quality of the research was not at the highest standard, but it was still obviously up to a moderate level. And this is something that we find in a lot of research, so this is no surprise, and certainly still holds a lot of weight in regards to the benefits in this context. So they used massage as a standalone treatment, so they didn't use it alongside exercise or alongside advice or alongside anything else, just on its own. And they found that it did help with pain in rheumatoid and osteoarthritis patients, and they also found that it improved their function as well. So this is obviously really intriguing. Now, they found that this was compared to non-active therapies and treatments, so this would be not compared against exercise-based therapies or anything else, but other non-active kind of treatments. So it means that you've got to take it with a pinch of salt, that used in isolation there may well be something that's better than it, but this means it still works. And this also means that it could be used as an adjunct to exercise therapy, rehab, and all that side of it. And that's something which I think is very warranted. Sometimes you'll see someone, for example, who has incredibly low exercise tolerance, low injury tolerance. So you're trying to get them to load through that joint, to get that joint going, and it just isn't playing ball. No matter how easy and how low level you go with the exercise, it's just really tough to get that going. So if you can lower pain with, say, massage, then you might then be able to then achieve that exercise and progress that exercise. So I think there's no doubt about it. If it can lower pain, it can improve the function of the exercise and the function of the person over time. So I would say that it looks like it's a viable option in certain cases without question, alongside exercise therapy and all the rest of it. So in isolation, I wouldn't say it would be enough, but it certainly could be beneficial. But if you want to get an optimal result, you want to try and use it in combination and try and use it as an enabler to the rehab side of the coin. So anyway, that's it for this video, and I'll see you next time.